Hello, my name is Grace Heidela, and I want to thank you for taking the time to meet with me today. I'm a nurse, and I'm going to be speaking about nurse burnout and its prevalence, as well as steps that can be taken to reduce the increased rate of burnout among nurses. I believe I'm qualified to speak on this subject as I myself have experienced burnout, and I have witnessed many other nurses around me experience it as well. Burnout affects about 70% of all nurses. This is according to a journal from the Healthcare Manager. The increased burnout is due to many factors such as emotional exhaustion, long hours, and an increase of work demand due to a growth in patient per nurse ratio. Duluth's population is on the rise, which will include more people that are going to be in need of care from healthcare professionals such as nurses. The effect of burnout has been especially affecting the new nurses in this field, as they have created less coping strategies and they have less experience in this professional field. This has led to an elevated number of turnover rates that can cost up to $4.6 billion annually, or $3.6 to $6.1 million per average hospital, according to Nursing Outlook. Burnout relates to negative impacts of effectiveness of care. It can lead to an increase in patient dissatisfaction as well as an increase in medical errors. When I worked as a CNA, I often had to work excessive amount of hours per week due to other CNAs quitting or CNAs calling in, which will require me to get mandated. This excessive work led to me experiencing burnout, as sometimes it would be one nurse and 2 CNAs to care for 15 to 18 residents. I often thought about quitting, as this was affecting other aspects of my life as well. However, I believe if the facility I worked at provided training on how to properly cope with stress and teach mindfulness, it would have created a more positive environment in the workforce, as well as taught me proper techniques to cope with the stress I was experiencing. One law that recently got passed is the Dr. Lorna Breen Healthcare Provider Protection Act. This act aims to reduce and prevent burnout, suicide, mental, and behavioral health conditions among healthcare professionals. This act provides grants for training healthcare professionals using evidence-informed strategies to reduce and prevent suicide, burnout, and mental health conditions among nursing professionals as well as other healthcare professionals. My request is that hospitals provide mindfulness teaching classes and coping strategies to healthcare workers in their facility, because it is very prevalent that this is still an issue today. It was very prevalent in COVID, but it is still occurring today. This will result and a decrease in turnover rate, as well as an increase in patient satisfaction and a decrease in medical errors. This is why I would like your help with getting mindfulness and coping strategy training incorporated into the hospital facilities. Thank you for your time.